Afternoon. Hi, this is Pam Hawkins, and welcome to the Children's Healthcare Reform webinar. So a couple of things just for general housekeeping. What I want to do today is right now we have everybody on an automatic mute. I have a couple of slides that I want to go through and talk to you about first, basically related to information that we've already gathered from some folks. And then we're going to then move on to a part where we can gather your ideas and suggestions for what we should present at the meetings in LA and Sacramento. And then we'll unmute everybody so we can just have a free dialogue instead of using all of the hand raising and stuff like that. So I think that'll be easier. So Irina Eryumenko is on the line with me, and Irina is going to be helping with this. She's going to be typing in our input as we go along. But Irina, if you can go to the second slide. So that basically what we're doing today, and this particular webinar call, is to gather additional input from you all about what you want us to present on in the healthcare reform meetings. And then I want to talk about some of the information that we've already gotten from CMHDA, Children's System of Care Committee, and we've already had a little bit of input from the California Council of Community Mental Health Agencies, as well as some input from the California Alliance of Child and Family Services. But primarily, I hope that folks representing those last two agencies are on the phone today so we can get additional information. So, Irene, if you can go to slide 3. Okay, so this is some of the information that we got from the CMHDA CSOP committee. They were interested in having us give as a handout and maybe talk about the Georgetown University's work on children's system of care and healthcare reform. Healthcare reform, and so that's one of the possibilities that we could talk about. They were also interested in the California Insurance Exchange. Apparently there are 10 health plans that are being considered, and so they wanted us to look at benchmarks for those 10 plans and whether or not they align with mental health parity, and then also looking at the table for mental health SA benefits, but those benefits apparently listed in that table were not focused on children's services. They were also interested in how family care that included drug, alcohol, and SED benefits, so with the Healthy Families Program, how does that funding work? How does that fit into healthcare reform, EPSDT, the whole thing? And then they also were interested in whether or not this new coverage under healthcare reform would be including autism and Asperger's spectrum, and then also wanted to talk about some values-based purchasing. And if we go to the next slide, Irina. Some of the other ideas that we talked to people about for consideration were accountable healthcare organizations. So how do children's mental health agencies fit into the ACO structure? How healthcare reform intersects with systems of care for kids and their families. Next slide. Some other ideas that we've had were related to the California Health Benefit Exchange and the activities. Healthcare reform timeline, so how are things rolling out, what's rolled out so far, and what do we have to look forward to in the future. People were interested in evidence-based practice and how that intersects with healthcare reform. And then additionally, I have some information on a conceptual framework on a public health approach to children's mental health. And so those are potential ideas. We can also talk about those and see if people are interested in those other ideas for consideration. So Irina, why don't you go ahead and unmute people so we can basically chat a bit about what ideas folks have for the healthcare reform meeting.
So I'm starting to unmute everyone. Just want to make sure there's no background noise.
So folks have background noise, go ahead and mute your phone. And I'm getting some.
If everyone could unmute their phone until they're ready. Hello, Pam? Hello? Pam?
Yes, Irina.
I just muted everyone. I think it would be better if everyone could mute themselves on their end, and when they're ready to speak, they could unmute themselves.
Okay.
So we don't get all the background noise.
All right. So, how do we do that?
Again. So I will unmute everyone, and then if they could mute themselves on their phone themselves.
All right.
Okay, I'll try this again.
If this doesn't work, we may have to go to the hand raising.
Yes. So it's good so far. Let's see.
All right. How are we doing with that?
Did I mute all? I think it'll be best to keep everyone muted, Pam.
Yeah.
And then, hold on. And then if they could raise their hand, and that way I'll unmute the person.
Okay. Let's try that.
Okay. If someone could test it out. Okay, everyone's clicking on it, so they're aware of where it's at. It's like a picture of a hand icon. So you would press that hand, and then we would know if you have a question or a comment to say, and we'll go to you and unmute.
Right.
So it seems like that will work, Pam.
And Irina, I don't have that feature on mine.
Because you're in the staff.
What?
You're a panelist, so you're not an attendee, but you're a panelist, so it won't give you that option.
Okay, so how am I going to call on people?
So I will, once they raise their hand, I will say the name out.
Okay.
So like, if we have Barbara Silver raise her hand.
The next slide, and then you can add in our, sorry everybody, I thought that this would work better to unmute everybody and just have a dialogue, but it looks like it's not going to let us do that. So I apologize for the of the webinar.
We have Mary that raised her hand. I will go ahead and unmute.
Okay.
Okay. Hello?
Hi, Mary. Hello? Can't hear you. Maybe she's still on mute.
No, she's unmuted. She was maybe just testing out the hand raise.
Okay. So why don't we go ahead and get any input that you may have. So if you have suggestions for what you might like to see at the healthcare reform meetings, please go ahead and raise your hand, and Irina will unmute you so that you can talk to us about some of the ideas that you have in mind.
Okay, Lynn has a question.
Hey, Pam, it's Lynn. Can you hear me?
Yes, I can hear you. Thank you.
Yay! Hey, a lot of our members have questions about the electronic health record and how that is incorporated into this whole rollout.
All right, so electronic health records. And Irina, you want to go ahead and jot that down, electronic health records? How that will intersect with healthcare reform?
Yeah, we had Herb Schultz present at our conference back in February, and he gave a great overview. So, of course, he's the federal guy, so he's a great resource. Yeah.
How that
so
will
intercept with the ACA rollout.
Okay. So Herb Schultz is a good resource on that?
Yeah, he's a good resource with it all because he's the federal regional guy in charge of California and the surrounding states about ACA in general, not just children's issues.
Okay. But I think it's going to be an issue regardless on the adult side or on the kid side.
Yeah, definitely. Because there's timelines around that, and I can't recall what the timelines are and what has to be accomplished by what date.
Okay. Okay, thank you, Lynn. Anything else?
That's all I can think of right now that stands out that you didn't already have listed on here.
Okay. Great. Okay. Well, I'm glad to know that somebody else is on there. And again, I want to apologize to the whole group for have a nice dialogue like I had anticipated to do. But anyway, thanks again, Lynn. And anybody else have any suggestions?
We have no hands raised at the moment.
Any, not just suggestions, but, if anyone has any comments about any of the ideas that we have listed here already, we'd be happy to hear those comments as well. I know this is an awkward way to have a conversation about this, but appreciate you guys bearing with us.
Okay, Irene has her hand raised. I'm unmuting. Hello?
Irene, hi.
We cannot hear you, Irene. If you want to maybe send us a question in the chat box. Okay.
That's another good way to, if you don't want to raise your hand, you guys can type messages in.
Okay. So let's see. Karen has her hand raised as well. Karen?
Can you hear me?
Yes, we can.
Hello.
Thank you, Karen.
Good. No, I just was wondering, Pam. Oh, I just was wondering if there's any way. I don't know if you can split the screen. At this point, I would be more interested in having the slide with your list up, so that we can, and I'll start writing that down. I can't pull up the individual slides, and I don't want to repeat what was on the list. Short memory. Thanks.
I don't know if we can split the screen. I mean, Irina, can you split the screen and put the other slides up?
No.
Okay. Well, then, for the moment, until we get some other suggestions, could we just go back to the list, and I'll try to make some quick notes here.
Sure, sure. So we can go back to slide 3, Irina.
Sure.
Thank you.
So, Karen, this is what the CMHDA CSOC committee had made suggestions of. So slide 3, Irina.
Okay.
There we go. Thank you.
Have you seen the healthcare reform and children's system of care issue brief that Jim and Beth wrote? That was one of the handouts that CSOC thought we should hand out. It's actually a pretty good document. So that's one of the things we thought we would comment on.
Absolutely.
You know, there's so many questions about healthy families and how healthy families is going to fold into all of this and what the funding is going to be. And healthy families itself is sort of up in the air at the moment, and whether or not, you know, healthy families gets rolled into Medi-Cal and realigned, or whether it stays intact as healthy families and the SED benefit stays intact. So there are some questions about all of that. Hopefully we can you know, get some answers to those if there are any, but at this point I'm not sure that there are answers for those sorts of issues. And as far as coverage for autism and Asperger's, you know, again, those are kind of questions I'm not sure we can answer, basically because I don't know how we would, you know, we would find out at this point, you know, that there are no plans for mental health to cover those two diagnoses, but, you know, as you know, primary care would cover those two diagnoses. So how that works together is sort of an unknown.
Yeah, I think there's going to be some real interesting discussions that are going to have to take place as we try to dovetail our California system with the federal, because the different states cover different issues, whether or not we're all going to have to go in that direction, or whether we're going to be able to come to some meeting of the minds within our context.
And then, Irene, you want to go to slide 4? And if other people have questions about this, please feel free to raise their hand. You know, hopefully if we, you know, have a couple of people that are not, you know, if we unmute a couple of people at a time, it won't, you know, the system won't echo and do all kinds of crazy noises. So anyway, some of the other ideas, Karen, that we had considered, talking about the ACOs and how children's mental health agencies fit in within that structure.
Yes, and there have been some good webinars on medical homes for children that have come from some of the national organizations.
And then on slide 5, a couple of the other ideas that we were considering was, you know, some of the activities of the Health Benefit Exchange Program, Healthcare Reform Timeline, a discussion on evidence-based practices and healthcare reform, and then a public health approach to children's mental health. So I don't know if these are ideas that people are interested in hearing more information on. Anything on here that we should absolutely not include? All right. Well, Karen, did you have any other input, any other ideas that come to mind that we should consider?
Well, thank you. As I say, the only other thing that I have been picking up on the larger scale is the medical homes.
Okay.
And also, of course, it's all part of the same, but through CalMen and other arenas have been doing some work on and particularly interested in integration with health care. And I think that's particularly important for our children and youth and their families. So as integration fits into all of this as well.
So, and maybe integration versus a collaborative approach?
Well, yeah, because I think that a collaborative perspective is a beginning step to actual meaningful integration. But
right. It's hard to imagine integration will happen right away.
Well, you know, and it's hard to separate out children and adults, because some of this that I pick up on is adult-oriented, and some of it has actually been incorporated in the children's arena as well. And a lot of it should be, if it hasn't already been, because we're looking at, you know, I had the privilege of touring Skid Row last week and seeing the clinics and now the integrated facilities that they're going to be building into their housing there, so that it becomes more one-stop shopping. And that's, you know, they're working very, very hard to make it as easy as possible for people with limited, not only limited means, limited transportation abilities and so forth, to be able to take advantage of all of the resources. So I think that's one of the things that we really want to look at is it's not just the services, but the delivery of the services.
Right, delivery approach of it, you know, same-day service, that kind of thing.
Yeah, whatever it takes to improve the delivery along with the services, so it's not just a matter of adding this or that or making sure that we keep this or that, but looking at how we can better deliver those services. And I think that whatever is going to be better for the children and youth and their families is also going to turn out to be more practical in the long run and cost-effective as well. I mean, I think all this goes hand in hand.
Yeah, agreed. I do agree with that too. Okay, so Irina, a couple of things to add to slide 6.
So I have Medi-Cal homes, integration versus collaborative approach, and delivery approach.
And right, so delivery approach, i.e. same-day service.
Okay. Also, I had a question saying, in discussion of medical homes, can you speak of how school health centers will work or not work with medical homes?
So how medical homes will what?
So can you speak to how school health centers will work or not work with medical homes?
Okay. So that would be another bullet point for the stakeholder input. So I can't speak to that right now. If somebody else is on the call and can speak to that, that would be great. But that's something that we could put down for consideration of talking about in the meetings. I just don't have the expertise to speak on that, but maybe somebody else on the call does. So if anyone knows about that, please raise your hand and Irina will ask you. But Irina, make sure that you get that question down for our bullet points.
Okay. And also, there's another question. A healthcare reform meeting was mentioned. When will this take place?
Okay. So if we scroll down to the last couple of slides.
Okay.
In slide 10, so there's going to be one meeting, but the same meeting will take place in 2 locations. So the first location is on the first meeting, I should say, is on May 14th, and that is going to be in Los Angeles County. The location is the LA County Office of Education, and that is located in Downey. And that first meeting will be held there. The second meeting on May 15th, and that meeting will be held in Sacramento at the CIMH offices. Form, and you're interested, so the Children's System of Care Committee will be sending out the registration forms. Also, folks from CCC, MHA, and the Alliance will be sending out those registration forms. If you don't get them, you can always contact me, and I'll make sure that you get those. And my contact information is on slide 11. So emailing would be the best way, and then I'll send you information on how to register. if you want to just shoot me an email at phawkins@cimh.org. So Irene, if you want to go back to slide 6 and then add in that additional information, would be really helpful. And then if people have other messages that they want to type to us, or raise your hand if you have other input for us, that'd be really great. And that would be medical homes, not Medi-Cal. Thank you. And anybody else? Irene, you see anybody with a hand raised or a new question typed in? We want to be able to get the school-based question too, the school health. Okay. All right. Any other questions, input? I know there's only so much with healthcare reform that we even know about. And we have a lot of the we have a lot of information here already. So I'm going to just give a couple of more minutes for individuals who want to give us some input. Otherwise, you know, folks are quiet. I'm assuming that means that there's no additional input, and we'll go ahead and wind this up. And I want to really thank everybody for joining the call. I want to really thank people that are giving input. This is really helpful to us in sort of guiding this meeting to give you the kind of information that that you want. Okay. All right then, Irene, if you want to just go to that last slide 11 one more time. I'll just put this up here for another minute. If people want to send me an email to make sure that they get the registration information, that would be great. Otherwise, you'll be getting it from the various organizations that you belong to. And one last opportunity for people to ask a question or give us input early. And again, I appreciate all of your help in helping us to define what we're going to do at these meetings. And then once we're at the meetings, you know, there won't be any mute buttons, and so we'll all be able to at least have a conversation there. So again, sorry about the challenges to the technology, and again, I appreciate everybody joining the call today. Thank you very much, and you all have a really great day, and now we have plenty of time to do other work. It didn't last as long as we thought.